I was sharing and speaking about artificial intelligence in multiple sclerosis, and I think that there are 2 or 3 different fields that are very important in multiple sclerosis. One of them is imaging. We do a lot of MRI, and for us the MRI is the most important tool for the diagnosis of the multiple sclerosis, so that the first important thing is to use the artificial intelligence to count the lesions, to know how many lesions are new, to compare always the number of the lesions with the last and previous MRI, and to know, for example, the second thing is to know if the patient has more atrophy or not. So that the first important, I think, help from the artificial intelligence to the multiple sclerosis will be in the imaging, in the MRI, to help us to count the lesions and to compare always with the previous MRIs. The second will be in the OCT, because we use the OCT to detect all the pathology in the optic nerve. And now we have, with the artificial intelligence, we can try to look for more parameters with the OCT to try to confirm the diagnosis of the multiple sclerosis, and the second to try to differentiate from NMO and MOGAD. And the third one, I think, that will be to help us in the diagnosis, so that when we can put in a program all the data of the patients with all the MRI data, with the fluid biomarkers, so all the things that we have, and we can try to do, in many cases, the differential diagnosis, because sometimes it's very difficult to do the differential diagnosis with the optic neuritis. Sometimes we don't know if it's MS or NMO or MOGAD, so that when we put all this data integrated in the artificial intelligence, probably we can have a better diagnosis in these cases that we don't know really what they have.